Caregiving can sometimes feel like an impossible struggle. Caregivers may be torn between taking care of loved ones and trying to maintain balance in life. The good news is that it doesn't have to be that way. The Caring Generation with host Pamela D Wilson is here to focus on the conversation of caring. You're not alone. In fact, you're in exactly the right place to share stories and learn tips and resources to help you and your loved ones. So now, please welcome the host of The Caring Generation, Pamela D Wilson.
This is Pamela D. Wilson, caregiving expert, speaker, consultant, and guardian of the Caring Generation. The Caring Generation focuses on the conversation of caring, giving us permission to talk about aging, the challenges of caregiving, and everything in between. It's no surprise that needing care or becoming a caregiver changes everything. The Caring Generation is here to guide you along the journey, to let you know that you're not alone. You are in exactly the right place to share stories and learn about caregiving programs and resources to help you and your loved ones plan for what's ahead. Invite your aging parents, spouses, family, and friends to listen to the show. If you have questions or an idea for a future program, share your idea with me by responding to my social media posts on Facebook, Instagram, Twitter, YouTube, and LinkedIn. This week, I'm answering the question, should caregivers use online healthcare? As you might realize, online healthcare is a big category of information that extends from using an online portal at your doctor's office that we'll talk about, all the way to medical technology. And one example of that is the use of continuous glucose monitors for persons with type 1 diabetes. These monitors communicate with a program on a smartphone that then communicates with an insulin pump to provide insulin, and it provides text messages and updates and reports to family members and the doctor about blood sugar readings and insulin doses. During this program, we'll talk about why patients and their caregivers hesitate or delay using online healthcare. We'll talk about the different types of uses for online healthcare, the benefits, pros and cons, and finally, the big picture of online healthcare, which is the ability of healthcare providers to share your information, confidentially of course, and why this could be helpful for you if you are in an accident or an emergency and need medical care. Should caregivers use online health care? Let's start with reasons caregivers and the elderly might not want to use the internet to share personal information. Number one is the obvious concern of privacy. So let me ask a question. Do you have a social media account on Facebook, Twitter, LinkedIn, Pinterest, maybe TikTok? If so, you've already shared your personal information all over the internet. When you think about healthcare portals, electronic medical records, and what's called health information exchanges, these all use the internet. But healthcare information is more secure than social media sites. Many caregivers and patients will ask me, well, can the government access my healthcare information if I join one of these portals or if I participate in any type of online healthcare programs? The answer is yes, generally, if you receive services from Medicare, Medicaid, the VA, or other social service organizations. But when you think about the security of personal information, there are a lot of things that consumers do that require giving personal information. You probably file your income taxes every year, or at least you should. If you apply for a loan or a credit card, you provide personal information. The company where you work has your information on file, similar to your doctor's office or medical center if you engage in the healthcare system. So, to put the question, should caregivers use online healthcare into a bigger perspective? Think about using an online medical portal as another system or another program, like all the others you use, that offers convenience and benefits that we'll talk about during the show. Another reason why caregivers don't use online healthcare could be no or slow internet speed. Now, while internet access continues to improve in big cities, right, large cities, metropolitan areas, there may be gaps in coverage if you live in a rural area, or maybe you have internet and it's just not fast enough. Then, besides internet, are the technology components that you need, right? You need a desktop computer, a laptop, a tablet, or a smartphone to use online healthcare programs. Even still, if you can get past the privacy concern, the internet speed, and you have a tech device, for a lot of people, there is the factor of learning how to use these programs and participate in online healthcare. So if you've never attended a webinar or had an online video call, this may be a challenge for you. But the COVID pandemic, if there's any benefit out of that, it's fast-forwarded online healthcare. Before COVID, we all had to drive to the doctor's office for an in-person appointment. During COVID, a lot of health insurance plans approved virtual care appointments. Now, after COVID, making appointments online and attending virtual appointments really are pretty normal unless you have a new or serious health condition and the doctor needs to physically see you. If you participated in and joined your doctor's health portal before COVID, you might notice that the portal has a lot more information and features today. Now, some physicians didn't have online portals before COVID, but a lot of them are making progress toward this. So really, when you think about the question, should caregivers use online healthcare, I believe that eventually it's going to be not optional, okay? So today, if you don't participate in online healthcare, you might be spending a lot of unnecessary time and effort to get care for yourself or an elderly parent. Think of online healthcare like online bill paying, banking, or transferring money. Now, I know a lot of older adults who do not trust online banking. They want to continue to receive those paper bank statements by mail and pay bills the old-fashioned way by writing a check because this is comfortable and it's the way it's always been for them. If you're the caregiver for a parent who continues to pay bills manually the old way, you may be trying to convince mom or dad to come over to the other side, that online banking is safe. Whether we like it or not, technology is advancing and it will continue to advance in all areas of life. It's true that the government, banks, financial systems, healthcare, many other industries and companies have and store our personal information. Did you ever think about this? There are cameras on traffic light poles that record your movements if you live in a city and you're walking down the street, or if you pull up to a red light and you run that red light. Sometimes they take your picture and you end up getting a ticket. Your smartphone, it tracks your daily movements from the time you wake up until the time you go to bed, especially if you use it to set an alarm and wake up. Maybe you don't have a car and you use Uber or Lyft for transportation. If you go to the gym, you might have a key card to get in the door, or maybe there's an app on your phone that gives you access. Cell phone towers, they track our movements if we're driving. If we're on a toll road, we pay a fee. The camera can take a photo of our license plate, or maybe you have one of those auto pay transponders. They send you a bill, right? They know you were there. We go to work, we clock in, we use a key card to get into the building. Honestly, there are very few things we do today that don't have automatic systems for tracking us using technology. Admittedly, all this technology makes our lives easier. So why shouldn't caregivers use online health programs to simplify caring for elderly parents and other loved ones? After all, if you're a caregiver, you're probably very overwhelmed with everything that you have to do. So why not make it easier on yourself? Why not streamline managing healthcare for an aging parent, spouse, grandparent, even yourself? Let's move to the next part of answering the question, should caregivers use online healthcare? Healthcare use depends on the users, right? You, the people you care for, could be your children, your aging parents. By signing up for online healthcare, which means you're gaining access to what they call a healthcare portal at your doctor's office or somebody else, your actions start creating a healthcare record that can save, over time, a lot of time, effort, and money. Here's how. Simple example. You, your children, or a parent receives a vaccination, like a flu shot, right? These are then entered into a system so that future reminders for boosters, if you need them, can be provided. That proof of vaccine exists electronically, so if your children's school or your workplace needs confirmation, it's there. Then, when you go to the doctor regularly, like we all should, like for an annual checkup, your blood work, your weight, your vital signs like your blood pressure, your temperature, those all go into a file so that that data can be compared with information from future visits and past visits. In this way, a doctor can identify changes in your health to recommend treatment or talk to you about a change in lifestyle habits. Having access to all of this healthcare information online really allows you more control over your health and well-being, or more control over the person, their health and well-being that you're taking care of. If you're a family caregiver, an elderly parent might have a condition like high blood pressure that you're managing, or maybe mom and dad have multiple health conditions. Having an online healthcare account makes tracking all of these healthcare conditions and the associated medications that are prescribed easier. Then let's say that there's an accident or some type of health emergency where your elderly parent has to go to the hospital emergency room. If you're already set up with one of these portals in your doctor's office, the people at the emergency room can pull up your parents' health history, which makes it easier for them. So let's talk about ongoing benefits of regular use of online health information and medical portals. You have access to medical information at your fingertips if you have access to a tech device and the internet. Information on that portal, you can print it, download it, share it with your family members. You can also request and make appointments online if your doctor's office has a scheduling system. Not all do, but worst case, you can send an email to request an appointment, and the office staff can email you options back. Now, if you've ever called a doctor's office and you have been put on hold, like seems forever, right? And then somehow you are disconnected after you've waited 10, 20, 30 minutes trying to schedule an appointment or ask a question, you know how frustrating that is. Using online healthcare portals to do all of this stuff can get rid of that wait time and minimize your stress and frustration. Online healthcare portals make it easy to communicate with your doctor and the staff if you want to share information, schedule an appointment, ask a question. But it's important to understand that your doctor probably receives hundreds of messages every week. So the person answering your question may not be your doctor. And if it's not your doctor, they should identify themselves as the nurse or whoever they are so that you don't feel like you're getting a misleading answer that you think is from the doctor and it's really from somebody else. Online healthcare portals make it easy to receive your test results for things like x-rays and images and blood work. Now, in a lot of cases, the results are posted to that healthcare portal before your doctor can even look at them and respond to you. So, very important. I know while you may be super tempted to search the internet to find information, you're looking at your test results, you think it might be bad news. Don't. Instead, give your physician time to review the information and respond. And if for some reason you don't get an update within a few days or a week, then send an email reminder. Another benefit, access to an online healthcare portal also allows you and patients, your parents, to make sure that the information on the portal is accurate, like your prescriptions, any over-the-counter supplements you take, changes in your health insurance plan. Now, the catch is you may not be able to update this information manually, but you can send a message to your doctor's office to request that they update it. You can also sometimes pay medical bills, which can be a time saver. You're not getting paper in the mail anymore, right? So in a lot of cases, this can be done through an online portal. Now, important to know, let's say you get a huge bill, $1,000, and you can't pay it all, right? If you need to negotiate special payment terms, sometimes there's an option for this online, or you can call the billing office to make those arrangements and say, I can pay $50 a month, I can pay this much, and I realize it's going to take me time to pay it off, but they will work with you. Plus, if you haven't created an online account with your health insurance company, take that step. Because then you'll be able to see information about your insurance deductibles, your copays. You'll kind of know where you stand when you go to the doctor. Also, there are things called EOBs, which are explanation of benefit forms or statements. Those are also online for each of your medical appointments. Add to that any type of pharmacy charges, so you go to your pharmacy and you fill a prescription. All that's on the portal. So initially, while setting all this up, this online healthcare portal project might seem to create a lot more work for you. In the long run, it saves you time and it gives you control over your information. Now, other types of online portals may be like for your local pharmacy may have one. If you go to Walgreens or CVS or something like that. And sometimes neighborhood pharmacies will have that information too. You can have an online portal. So accounts at the big providers like Walgreens and CVS, they can automate your prescription refills so that you don't even have to remember to call them in every month. They'll send you a reminder to say, hey, your prescription's ready to be refilled. Do you want to fill it? And you can pay for it online. You can pick it up. You have to drive to pick it up, though, of course. It's not going to, some prescription places do deliver it to your home, but most of us pick them up, right? Same thing for vaccinations. If it's time for an annual flu vaccination, you can go online and schedule the appointment and complete the paperwork before you show up there, which saves you time standing in line at the pharmacy, and it saves the pharmacy workers time. So as you can see from all of these examples, the use of online healthcare can save time. If you're a person who's not tech savvy, which a lot of people are not, ask your children or a friend who's familiar with using the internet and computers and programs to help you set up an account and then create a place to save your login and password information. A lot of medical portals now also have an online system for privacy, a system to verify that it's actually you signing into the account. So the idea is whenever you set up the account, don't save whatever tech device you're using as a trusted source, especially if you share it with other people. So if you don't do that and you log in, the program will say, hey, I want to send you a code to your text on your phone, or I want to email it to you to confirm that it's you accessing the account. You put your email in, they send you the code, you get the code, you enter it in, and then you can get access to the portal. It's really a great safeguard, again, if other people use your computer or your tech device, or if you're accessing information from a shared community device. Maybe you've used the computer at the library. So we're going to take a short break, and after that, we're going to take this question: should caregivers use online healthcare to the next step by talking about electronic medical records, EMR, and health information exchanges, they're called HIEs. And we're going to talk about how some of these have value-added assistance for managing health and ongoing concerns. Listeners, caregiving does not have to be a do-it-yourself job. This podcast, The Caring Generation, answers questions caregivers ask. It's available worldwide on my website and your favorite podcast and music apps, Apple, Spotify, Spreaker, and more. This is Pamela D Wilson, caregiving expert and elder care consultant on The Caring Generation. Stay with me. I'll be right back. This is Pamela D Wilson, caregiver expert, advocate, and author on The Caring Generation. Check out my website, PamelaDWilson.com, where you will find my online caregiver educational program, book, The Caregiving Trap, my caregiver blog, this podcast, my caregiver library, and a way to schedule a telephone or virtual consultation with me. There's something for everyone on my website, PamelaDWilson.com. So let's return to more answers for the question, should caregivers use online health care? One aspect of electronic medical records that many older adults really don't like is the decrease in face-to-face conversations with doctors. When I would take my elderly clients to doctor appointments, they would always complain that the doctor wasn't talking and looking at them, but instead was typing into their computer. So more screen time versus more face time, personalized attention, right, is one downside of using online healthcare. If you're at an appointment, somebody's got to type in those notes. It's usually their provider, who's the doctor or a medical assistant or a nurse practitioner or a nurse. Same thing if they're talking to you on a video call online, they're looking at you, but they're also typing. So this leads to a significant part about visit notes that we want to talk about from your doctor appointments. So when the doctor's typing, they've got to type in a diagnosis code for that appointment so that your insurance company pays for it, and they have to enter notes about it. So this means that if a doctor makes a health recommendation to you, this goes in the notes. In addition, if you're a caregiver or you're the patient and you're giving information to the doctor, that's entered into the notes. So if you're a caregiver and you accompany an elderly parent or grandparent or somebody to a doctor appointment, it's important to be as specific as possible in describing changes in health conditions. Depending on the health condition of a parent, maybe you track their blood pressure every day or their temperature or things like physical activity, weight loss or weight gain, or other measures that are helpful for the doctor. This is patient-supplied information. So think about this. If a doctor makes a recommendation and you or your parent refuse, this is documented. If you're refusing, you want to make sure that you're asking questions or giving a reason that you or an elderly parent don't want to follow a treatment recommendation or take a specific medication. Because let's say that you refuse and there's no explanation documented, and your parent's health or your health is getting worse, and the doctor keeps suggesting and you keep refusing. These refusals that are documented can be viewed as troublesome, problematic, right? It can, make the doctor look like the doctor's not doing their job, or the health insurance company may be like, well, gosh, why is this patient coming to see us when they're not following recommendations? So this can mean a couple of things, though, right? It can mean that the doctor seeing the caregiver or their patient might not be really great about making explanations about why something should be done, or understanding your reasons for why you don't want to do something. In my experience, people or patients that doctors might view as difficult really aren't difficult. In most situations, there is a gap in not following or refusing to follow a doctor's recommendation, and that is a gap in information or patient education about a disease, about heart disease or arthritis or stomach problems. A lack of education about a treatment or consequences of not participating in care. In my years as a care manager, guardian, and power of attorney, I was the balancing factor between doctors and many of my clients, who some healthcare providers honestly viewed as too time-consuming, too complex, too many health issues. They viewed them as problems. Add to this that doctors always don't communicate information in words that patients understand. I can imagine many of you have experienced this. On the other hand, the doctor says something and you want to ask a question, but you're too afraid to ask or you don't want to appear stupid. These gaps, these communication gaps, is the reason that patients don't get the care they need, or feel like the doctor doesn't care about them, or the doctor feels like the patient isn't listening. So, should caregivers use online healthcare? Can it make all of this easier? It can. You can type your questions in. You don't have to feel stupid. You can send them in 24/7 and you'll get an answer. Now let's talk about people who have systems and maybe people who don't. So depending on your primary care doctor, their online healthcare portal might be a standalone system, which is a system that operates by itself. Or you might have a doctor that's part of a healthcare system where they're part of a huge portal. Examples of healthcare systems include places like Kaiser Permanente, HCA, Common Spirit, Ascension, Trinity Health, even the VA Association. So if you register for the medical portal with a healthcare system like one of these, then all the doctors, the specialists, hospitals, any providers that they own share your healthcare records. So as the caregiver or the patient, you can look at all these records that you have on file with each doctor. Now, as I said, you can be part of this healthcare system, but maybe you see a doctor outside the system. That doctor may have their own separate online health program. So it's possible to have access to and manage information in more than one healthcare portal. For example, if your state has a health information network, this is known by the abbreviation of HIE, that's my medical speak term, then it's still possible that doctors in different practices can gain access to your health records. But the question is, how would you know? The best way to know is to ask your doctor's office or sign a form giving your doctor's office permission to share records with other providers. Now, I'll tell you, in a lot of cases, the paperwork that you completed when you go to a doctor appointment has some form for information sharing that you may have signed and not really read thoroughly. So if you're curious about whether your state has one of these health information networks, an HIE, go to the show transcript. I'll put a link in there where you can research this information. You get there, you go to PamelaDWilson.com, Media tab, The Caring Generation, and then check on this week's show. Health information exchanges, they're also an initiative of the government to make information sharing easier. Medicare and Medicaid also launched an electronic health record incentive program. I'll put a link to this program in the show transcript. There's also income-based programs like Medicaid. Sometimes those have extra support programs that are coordinated by case managers at the Medicaid office or the long-term care office. If you're a caregiver of an elderly parent who's on Medicare and Medicaid and you're not familiar with other programs that might be available to you, see if you can find out the name of the case manager who's assigned to your parent and contact this person. You can learn about other services that might be available or helpful. And if you're the caregiver wondering, well, does my parent qualify for Medicaid? I don't know. It's a program that supports care for low-income elderly. To find out, you can contact your county office of Aging Services or the County Department of Human Services, and one of those should be able to direct you to the organization, if it's not them, that manages the Medicaid program or the long-term care program. In some states, case managers at the Health Information Network also provide additional support. Things like transportation to medical appointments, access to food programs, and other social service programs. So if you're in doubt about, does my parent qualify for these programs, don't be afraid to ask. Now, while some programs require that you have to submit paperwork or applications, I'll tell you the effort to apply might be time-consuming, but it's well worth it because your elderly parent can receive a lot of other assistance. Part of using these online healthcare programs is learning to use the programs to become an advocate for yourself or the person for whom you care. And then once you use one, you can easily use the next and the next and the next. Some online healthcare programs, especially in the Medicaid and long-term care field, allow the patient and the caregiver and everybody else to look at all the programs, and you can see the communication back and forth between various agencies who are offering assistance. Being proactive to use the online healthcare portals really does help caregivers help elderly parents to manage their health, to stay healthy, to remain out of the hospital, which is the goal. And if you as the caregiver use an online portal to manage your health, the research shows that you're more likely to do the same to help your elderly parents to manage their care. Now, the last topic I want to mention regarding these health information exchanges is a pretty cool thing. The information in a lot of cases can cross state boundaries. So if you or a loved one are thinking about taking a trip and you're worried about, oh, what happens if I get sick or go to the hospital? Well, it's very possible that the provider you see in another state can access your healthcare information if you participate in these online portals. If you don't, that's a no-go. So in a sense, using online healthcare portals, above all the benefits and the pros and cons we talked about, make sure that you or your elderly loved ones can get care services from various organizations, regardless of where you live or where you travel. So suppose you are a young caregiver and you don't have a primary care doctor. In that case, it's time to establish yourself with a medical practice so that you have this system, just like your parents, to track your health care, to receive health care support in the event of an unexpected illness or accident. Don't be that caregiver who neglects your health so much while taking care of everybody else that you're eventually going to be the person who needs care. You deserve the same equal time and attention. If your elderly parent or the person that you're caring for is not set up on an online healthcare portal, call the practice, call the doctor's office, and find out how you register. Sometimes these portals exist and maybe information was given to your parent and they threw it out because they didn't know how to use it. So unless you ask, maybe the office assumed that your mom or dad was already established on the portal when they're not. Becoming aware of how these medical practice portals work and how to gain access to your electronic medical records, your billing, your prescriptions, everything, it truly will help you manage your care and support the people you care for, elderly parents and others, to get the care they need from the medical system. I thank all of you for continuing to pose these questions for the podcast and the videos that I create and share on my website and on my YouTube channel. This is Pamela D Wilson, family caregiving expert on the caring generation. If you're looking for answers to caregiving and aging questions, visit my website, PamelaDWilson.com, where you'll find my caregiving library, online caregiver courses, Caring for Aging Parents blog, my book, The Caregiving Trap, plus an extensive step-by-step online program to help you learn the A to Z of caring for yourself and elderly parents. I look forward to being with you all again soon. God bless you all. Sleep well tonight. Have a fabulous day tomorrow, and enjoy every single day. Be healthy, be happy, be loved, until we are here together again.
Tune in each week for The Caring Generation with host Pamela D. Wilson. Come join the conversation and see how Pamela can provide solutions and peace of mind for everyone. Here on Pamela D. Wilson's The Caring Generation.